Hey guys, my name is Dr. Nathan Thompson with the Wellness Way Yorkville. Happy Monday, guys. Hope you guys had a great weekend. Palm Sunday coming up to Easter. I hope you guys, if your kids are off right now, I hope you guys are tolerating them well. Tonight, we're going to talk about something really interesting. We're going to talk about statins, statin medication or cholesterol lowering medication, and fatigue. And so let me know, guys, if you're watching on Facebook, on YouTube, or on Rumble. Make sure that you say hello. Also, let me know where you're watching from as well. Over the next few minutes, I'm going to go over a lot of awesome things. And I'm also going to make a shocking admission as well. But I'm going to explain to you why. But if you are watching me on Facebook, YouTube, also on Rumble, you'll be able to see, hopefully, the slides and be able just to get a better experience. So statins and fatigue, okay? Now, I've had a lot of people reach out to me and they're give me their history and things like that. I understand it. I get it. But guys, if you are from the Chicagoland area, our next in-person inflammation talk is going to be on Tuesday, April 2nd at 6:00 p.m. If you're watching on Facebook, if you are watching on YouTube too, you could actually go to our link tree. Also, you'll see the direct link to be able to join our inflammation in-person event. This is for people from Chicagoland area. We've had a lot of people reach out and say, hey, I'm struggling with this. What do I need to do? And I'm always going to say, get to the inflammation talk because it will make so much more sense to you as well. So if you're from the Chicagoland area, Tuesday, April 2nd at 6:00 p.m., this is an in-person event. This is going to be a week from tomorrow. Come to that inflammation event. We'll have a special gift for you on that day. But it's very, very important to understand where we're coming from and understand a different approach, especially. In addition to that, we're also going to talk, you can join our inflammation webinar. Just go and you'll see a link to be able to join that at the top of the page. And this is for people who are the Chicagoland area, but they're still in the contiguous 48 states in which we can work with you remotely. Guys, probably in April, I'm going to tell you this, we're going to be taking that down only for time constraints and things like that. So make sure that if you haven't watched that webinar, rather than reach out to me and say, hey, what do I do about this? Watch the webinar. You'll see a link to be able to schedule a discovery call with me at the end of that webinar. And that way, that's how we get connected. So make sure that you go and join that webinar especially. Now, for those people who are doing the You Don't Know Squat Challenge. Thank you guys so much. We're also almost all the way through March, which is really important because we've done 3 challenges over the course of a couple of months. We've done the 5 Minutes of Fire, we've done Meats and Veggie Only Challenge, and we've also done the You Don't Know Squat Challenge. And so we want to help make your lives better without costing you a cent. And in fact, I've asked the question, is it important for a doctor to actually follow through and do what he preaches? I believe that it is. And this is actually me today doing the You Don't Know Squat Challenge. So in fact, if you are watching and you can see the slides, you're going to notice little Elias in the background staying really busy, playing with some things. But that is me holding about a 5-minute squat. And this is me actually doing some back squatting, not super heavy, but heavy enough for me, especially. So, and being 47 years of age, I really think that you have to, people say, enjoy your youth. I'm like, no, work on preserving it. So many people, and in fact, I look at, Elias, who's just a year of age, he's got a perfect squat. No one had to coach him on how to do it. It's just perfect. And so it's an innate movement, but somewhere along the line, we lose that gift. And so we need to help preserve that gift for as long as possible. But I think it's important for me to do the challenge right along with people as well. And I am. So I hope you guys, we've had people who have sent me, messages and who have sent me, videos of saying, hey, look at me, my squat is getting so much better. I'm like, I'm so happy for you in order to add some value to your life. But what's one of the biggest reasons why I want you to do the You Don't Know Squat Challenge is because of this. What you see here is you see a toilet. And here's what I always say. You can have perfect labs, but it's not going to matter if you can't get off of a toilet. So if you have perfect labs, you can't get off the toilet, guess what? You're still going to the nursing home as well. So that's why we want you to be healthy, body, mind, and spirit especially. So let's talk about statins and fatigue. Statins and fatigue. The first thing I want to do is I want to give a disclaimer. It's this. I'm not telling you to do anything, but I'm going to share with you an experience. I'm also going to share some research as well. But I think it's important to share my experience as well. This is what I believe, is that my life is my testing grounds. And the reason why is that growing up, I had all kinds of issues going on. I grew up with asthma. I grew up with allergies. I grew up with terrible acne. I grew up with irritable bowel syndrome. I grew up with a lot of joint pain. I grew up with a lot of issues that are going on. And I always said, God, why do I have all of these things when my friends, they don't have any of those things? And it wasn't until I discovered my purpose that I realized all of those things had a purpose behind them. Yes, I did suffer, but through that suffering, I actually was able to develop compassion. I was also able to develop or be able to understand what people were going through. And so I really do that. My life is really my testing grounds, which is why I will do certain things, even if I know they'll have a negative health consequence, like overtraining sometimes and things like this. But I've overcome quite a bit with the Wellness Way approach. I've helped so many other people be able to do it. But one of the things I want to go over with you is this. So this was about 4 or 5 months ago. I got some blood work done and my cholesterol was pretty elevated. Now, if you go to the doctor and your cholesterol is elevated, doctor's going to be like, you need to be on a statin drug. And I'll go over with you why. I think there's better things that you can do as well. But my cholesterol is elevated. And the doctor's like, you need to be on a statin drug. And I'm like, okay, I'll do it. But I was acutely aware of some of the side effects that I needed to be looking out for. And I was acutely aware of what would happen. But the thing is this. I decided to do it not because I knew it was going to benefit my health. I did it so that I knew what people would be experiencing when they went through it. I think there's a great benefit to being able to suffer through things so that you can understand what people are going through. This is also true when it comes to hormones, but ladies, I can't make myself a woman to know truly what you're going through when it comes to menopause and having some issues with it. Okay. So several months ago, I went on a statin medication. So with the intention of not staying on it long term. And I know what some of the natural health people are going to be like. They're going to be like, how could you do that? You know, whatnot. And here's what I have to say. The reason why nobody follows you is because you don't have any compassion. Okay. I wanted to know what to expect and what it felt like going through that process. So when I went on a statin medication, after a certain amount of time, and it was about a month or so, here's what the symptoms that I started to develop. Number one, I started to develop debilitating fatigue, especially after exertion, especially after a workout that involved high intensity exercise or any workout that involved a lot of lifting too, of using my muscles. I also developed very itchy and very weak muscles. What I mean by that is this, is that I would do a set and fatigue my muscles. And you know that when you get to the end of the set and the muscles start to burn, my muscles would never burn. You know how they would feel instead? They would start to itch. And I also had very, very weak muscles. And so I saw my strength really starting to decline as well. Then I started to develop very dry and itchy skin, which makes sense. The reason why is because you lower cholesterol. Cholesterol is needed for the skin. And if you are lowering cholesterol, you're lowering the amount of cholesterol that can be deposited in the skin. And the reason why is that cholesterol helps to keep water in the skin. That's why when you look at people and they're on long-term statin use, why they look so old, aged, and I'm not going to give you any examples of people that I know that have been on long-term, but you'll see that they'll have dry, cracked lips, very dry skin. There's a lot of other side effects that can take place. But then I also developed very severe brain fog, and I had a very severe problem with concentrating things for a long period of time. So severe brain fog. I did some post-blood work too, just to check on some things. And I had elevated liver enzymes for the first time in my life I'd ever had it, but elevated liver enzymes that was suggesting liver toxicity. And then I also tested my testosterone. I usually test it every year. And so over the course of the whole entire year, my testosterone went down by 50%. Not so bad that I can't function, but bad enough. That's one of the first things that I would say. So debilitating fatigue after exertion, very itchy and weak muscles, especially after exertion, dry, itchy skin, severe brain fog, hard time with concentration, elevated liver enzymes, and also lowered testosterone too, and it was by 50%. So if you look at how cholesterol lowering drugs, specifically statin drugs, how they work, basically how they work is they inhibit an enzyme within the liver. This is why if you look at a lot of statin drugs, they're called HMG-CoA reductase inhibitors. So what do? They inhibit the production of certain things within the liver, which means that downstream, you're going to see a decrease in production in cholesterol. What's interesting is if you look at the biochemistry behind that, and you also look at a decrease, if you block production upstream, you're also going to block production downstream of, yes, cholesterol, but also CoQ10, okay? So you're going to see a decrease in production of CoQ10. That's why if you look at Lipitor, that's called an HMG-CoA reductase inhibitor. So it blocks a specific enzyme in which it will lower your cholesterol levels being produced by the liver, which also means if you block it there, you have to block the production of CoQ10, which is a very important, I don't want to call it a vitamin, but it's very important for healthy skeletal muscle function, for brain energy and things like that. It's how the muscles, they use that for aerobic energy, especially. So if you look at any kind of HMG-CoA reductase inhibitors, statins, what they do is they will block not only the production of cholesterol, they will block the production of coenzyme Q10, in which is needed, especially with your muscles, in order to produce ATP, otherwise known as energy. So it's kind of like this, guys. If you've ever heard of organic acid testing, in which we did this many, many years ago. We don't do it now because I really believe that if you do like organic acid testing, it will show a blockage happening at one point, but the only thing, it doesn't tell you why, it doesn't tell you even where to start. So the only thing that happens is you go on 19 different supplements that you really need to be on for the rest of your life. But I want you to think of this. Even when someone uses organic acid testing, it's kind of like this. I need to get outside, but in order to get outside, there's only one way out, and I need 3 doors to be able to open from one room to the next. So if one of the doors is actually locked, you can no longer get outside. And if you had 30 people that needed to get outside, they're getting blocked at the locked door. And so that's why with organic acid testing, you'll see an overflow of certain things that are getting produced because a certain biochemical process is being blocked. And so that's what happens is it's blocking certain things of production of certain things within the liver, which also means that things like CoQ10, it can't be produced. So very, very important for you to understand this, how a medication will actually work. Why is CoQ10 actually important? Let's go to the Mayo Clinic. And here's what they say about coenzyme Q10. Coenzyme Q10 or CoQ10 is an antioxidant that your body produces naturally. Your cells use CoQ10 for growth and for maintenance. Now, what they also say is levels of CoQ10 in your body decrease as you age. Well, that might be true because a lot of people beat themselves up as they've gotten older. CoQ10 levels have been found to be lower in people with certain conditions. Now, listen to this, such as heart disease and in those who take cholesterol lowering drugs called statins, straight from the Mayo Clinic. Where is CoQ10 found? Well, it's found in meat, fish, and nuts, okay? The amount of CoQ10 found in these dietary sources, however, isn't enough to significantly increase CoQ10 levels in your body. So where is it found? Well, it's found primarily in kidney, heart, and skeletal muscle, and it's also found in liver. Here's what's interesting, because people are like, should I go on a CoQ10 supplement or something like that? Some people may need that, but where is it found the most? It's found the most in organ meats. And how many of you actually are eating organ meats like heart or liver or kidney? All have been found to have high levels of CoQ10. That's why we recommend liver to so many people, because there's higher levels of CoQ10 actually with it. So the Mayo Clinic actually says that your cells need CoQ10, and it's very, very important for growth and for maintenance of specific cells. So if you look at CoQ10, CoQ10 is needed in order for aerobic energy production. Now, here's some studies that have been found. This comes from the Archives of Internal Medicine of 2012. So this is about 11 years old or so. And the title of it is this: the effects of statins on energy and fatigue with exertion. This is a result from a randomized controlled trial. Because how many times does someone say, oh, you have fatigue? Well, the research shows that it doesn't happen. And you're like, why are you gaslighting me? That's what my experience is. Remember this, no one can take away your experience. No one, not anyone, can take away your experience. I'll talk about that in just a second. So from the Archives of Internal Medicine in 2012, effects of statins or cholesterol-lowering medication on energy and fatigue with exertion results from a randomized controlled trial. This is going to blow you out of the water. Now watch. They say no drug is without adverse effect potential, and fatigue and exertional intolerance are adverse effects reported by patients receiving statins. Although many observational reports have cited fatigue and exertional fatigue with statin use, to our knowledge, no randomized trials have addressed this issue to date. So they're finally addressing it about 11 or 12 years ago. So here's what they did. They took a total of over 1,000 people, 1,016 subjects. And they had here's what's interesting, no cardiovascular disease or diabetes. So they left those people out. They were randomized equally. One group received 20 milligrams of simvastatin, 40 milligrams of pravastatin, or they took a placebo, which was microcrystalline cellulose, that was taken at bedtime in identical blinding capsules, and they did it for 6 months. So they had people taking 20 milligrams, 40 milligrams, and then they gave them a placebo so they wouldn't know the difference between the two, okay? Now, here is what was found from one of the first studies that they have ever done to look at this. The results were this. Energy and exertional intolerance were significantly higher in men and women, but women, I should say, were disproportionately affected. Here's what they found in the ones that were actually taking the statin medication. 40% of women reported worsening in energy or they experienced exertional fatigue. 10% of women reported both energy or exertional fatigue as being much worse. Much worse. Now, if you have ever been on a statin or you know anybody that's been on a statin medication and they have had a negative consequence of having dry cracked lips, or they're having muscle pain, joint pain, or they're having exertional fatigue, or just having fatigue in general as a result, go ahead and leave that in a comment below. Share with us your experience. Please make sure that you do that, okay? Share what your experience is, because I believe that your experience is valid, okay? I believe that it is. So they said that in 10% of women, it was much, much worse, but women were disproportionately affected, okay? Now, here's what it says in the comments from that same exact study. To our knowledge, this is the first randomized evidence affirming unfavorable statin effects on energy and exertional fatigue. Effects were seen in generally healthy sample given modest statin doses. And particularly for women, these unfavorable effects were not uncommon. They were not uncommon. And this is how they ended it. Meanwhile, physicians should be alert to patients' reports of exertional fatigue or diminished energy during statin use. Now, let me ask you guys a question. How many of you went on a statin, the doctor didn't tell you whatsoever of what to expect as far as side effects? You started experiencing side effects and you didn't know what was going on. And it was very concerning because you didn't know that a statin medication can cause problems with fatigue and or exertional fatigue, and the doctor did not let you know. Now, you might be saying this, oh, but I don't have any kind of exertional fatigue. You might not, but think of this. Do you do any kind of any form of high intensity exercise to stress your muscles and your cardiovascular system to even notice? See, a lot of people, when they're actually not stressing their muscles all that much to even notice if they're getting any kind of exertional fatigue. They're not even doing any kind of exercise to notice that they are having some kind of exertional fatigue. And what I mean by exertional fatigue is you do some level of exercise, high intensity exercise, you do a really hard workout, and you're in bed for the next 2-3 days because you're absolutely destroyed and so tired from actually doing it. So here's what it seems. I'm going to show you some more research in regards to this, is that the individuals who are having the most side effects are the ones who are probably using their muscles the most. And why would they use their muscles? Because they're exercising. Here's an interesting article from the British Journal of Clinical Pharmacology. Professional athletes suffering from familial hypercholesterolemia rarely tolerate statin treatment because of muscular problems. So they looked at 22 professional athletes, and they were on a treatment with different statins was attempted. Only 6 out of the 22 finally tolerated at least one member of this family of statin drugs. In 3 of these 6, in the first statin prescribed allowing training performance without any limitation. These findings indicate that in top sports performers, only about 20% tolerate statin treatment without any kind of side effects. So it's not like 80%, like 80% are absolutely fine. No, they said that 80% are experiencing a side effect from this medication. That should be very alarming as well. Why is it that so many people are having so many issues when it comes to muscle performance, and who is affected the worst? Professional athletes who exercise and using their body is something that they are doing every single day. So you can see that they're just not tolerating it very well. And you know what happens when you don't tolerate something very well? The doctor's like, well, throws up their arms and says, let's just try a different one, right? Is that we know that you need it. Let's just go ahead and try a different one. And you go back and you try 6 different ones to try to figure out which one has the least amount of side effects. And my concern is this: why are you giving them 6 chances? Because when it comes to what we do, you know how many chances people give us? They give us 1, and then they go back to the doctor. Let's just try a different one. Now, I'm gonna give you a different perspective. If you really want to fight vascular disease, then kill off your macrophages. Everybody talks about cholesterol, and just remember this: it's the immune response. If you've ever heard of foam cells, where are they coming from? They're coming from macrophages. It's the immune response that's producing the plaquing. If you really want to fight vascular disease, then kill off your macrophages. And that's a really stupid thing to do, because if you decided you're going to kill off all your macrophages, you would die from an infection before you would die of any kind of vascular disease, because you need all of your immune cells. Go back last week how I talked about corticosteroid use and why it can be so detrimental to the body as well. So here's another article from Complementary Therapeutic Medicine. This is about 5 years ago. Effective coenzyme Q10 supplementation on fatigue, a systemic review of interventional studies. So a number of studies have examined the beneficial effects of coenzyme Q10 on fatigue. It seems, they say as a conclusion, coenzyme Q10 has better therapeutic effect in statin-related fatigue and also in fibromyalgia patients compared with other disease-related fatigue. Now, guys, just remember this, because a lot of you are just going to run out and you're going to CoQ10 think it's going to take away all your problems. Fatigue is multifactorial. But here's something that's directly related to, I took this and my fatigue got a lot worse. So CoQ10, they've actually have found that there's some benefit from actually taking it, because the production goes down so much when you're on a statin drug, because it blocks certain things. So should you go on CoQ10? I don't know if you should or not. However, what they're saying is that it is related to statin-related fatigue and also fibromyalgia as well. But you know what they always say is that the data is weak and we need more trials. That's what they always say. And I'm like, we need more trials. And I'm like, why would you do more trials when you can't patent the solutions as a drug? Why can't you? I talked about this about 2 weeks ago. I talked about neuropathy and thiamine. And they actually said in that article is like, no one wants to do an RCT, a randomized controlled trial, because if the answer is thiamine, then we can't patent it as a drug. And no one wants to invest in a RCT, a randomized controlled trial, without any kind of blockbuster of making money from a new therapeutic or some kind of new drug. So why would anyone want to do more trials when you can't patent CoQ10 and use it as a drug? Who would want to fund that? Because a pharmaceutical company wouldn't want to do that, because they can't create a drug from something that's non-patentable. Hopefully, guys, that makes sense. So this comes from International Journal of Molecular Science. Disorders of human coenzyme Q10 metabolism, which is an overview. Now, here's what's really interesting. Pay attention to this. In statin therapy, a deficiency in CoQ10 status has been suggested as a possible contributing factor to the myopathic side effects or muscular side effects associated with this pharmacotherapy. The decrease in circulatory CoQ10 status following statin therapy may reflect a decrease in blood low-density lipoprotein or LDL status induced by this pharmacology. Now, here's what they said at the end. Now, listen to this. LDL is the major carrier of CoQ10 in the circulation. Let me say that again. LDL, low-density lipoprotein, is the major carrier of CoQ10 within the circulation, okay? Now, just remember this. So just remember this. No one can take away your experience. No one can take away your experience. That's been my experience, and I guarantee you people are going to try to take that experience away. Anything else that they're trying to take away from your experience is really just a form of gaslighting. It really is. And what is gaslighting is belittling the victim to try to preserve your ego. And I see it happen all the time, especially on social media. So anything else, they can't take away your experience. Anything else is just gaslighting, which is belittling the victim in order to preserve your fragile ego. When they say there needs to be more studies, I guarantee you is that a doctor isn't going to fund a study. And I also guarantee you is that a doctor, even if in the overwhelming evidence, they're not going to change their mind because they're too far down the rabbit hole with their career to be able to, and so invested in that profession that they probably will never ever change their minds, even in with a preponderance of evidence, even a way through. So people ask me, Dr. Nate, what did you do with your statin medication? I threw it away. I threw it away. Never, ever again am I going to take that crap. Okay. And here's the reason why. That was my experience. There's the research that I went over for you. And I'm not going to tell you guys what to do, but I will leave you with this. I would rather have my quality of life, not laying in bed being so absolutely fatigued, than lay in bed debilitated with a 5-year, 1% absolute risk reduction. It's a 1% absolute risk reduction over 5 years, okay? I would rather have my quality of life and be able to play with my kids, to be able to be around for my family, than to be laying in bed to reduce my risk by 1%. And that's what they actually say is a 1% absolute risk reduction, which is kind of like this, is that people in their 50s or 60, and they're like, well, thank God I didn't have a heart attack. And if you're watching this, you can see the slides, but look at this house. This house is decaying, it's dilapidated. And guys, remember this, your body is where your spirit lives. Yes, I believe you have a spirit. This is where your spirit lives, and it's in a dilapidated body that's decaying, crumbling, and rotting. That's what healthcare is today as well, is they're like, yeah, we are keeping you around, but they never change anything when it comes to your lifestyle. That's why we do the You Don't Know Squat Challenge. They never do anything. And so you make it to 70, you make it to 80, but you are sick with chronic degenerative illness and your body is falling apart. And they have proven that is that we lead the world in living the longest with chronic degenerative illness because doctors are really good at putting out fires. And if you're really good at putting out fires, but you never try to figure out why it happened, and all you do is sprinkle your house with water every single day, well, pretty much you're living in a decaying, rotting house. And so, but most people are living that way. That's where their spirit is living, is in a condemned, decaying and rotting house as well. And in fact, if you don't believe me, then go ahead and follow people who promote statins and have been on statins long term. They don't look well. They don't look well. Dry, cracked skin, very low testosterone type of people, as well. They just don't look well from doing that. And if you understand it, you start looking at long-term statin use, see what it does long-term, especially to the body. That's why, guys, so that's why I threw it away. And that's just my experience. And I'm not telling you what to do. I can't tell you what to do, but I can only share with you my experience. And that's why coming up on Tuesday, April 2nd. That's our inflammation talk in person. So if you're from the Chicagoland area, please make it to that. We have a gift for you, obviously, at the end. Please do that, guys, because that will help you to understand our approach. That will help you to understand where you need to start as far as getting your health back. You need to work on getting your health back, which is why people come in and they're on so many medications, on so many drugs, and no one's ever taught them what it takes in order to work on getting their health back. And guys, if you have been on the fence as far as getting to the inflammation webinar, please do that and do it right now. The reason why I say that is because coming up, we're going to just take it down as well, just for time constraints. And people ask me all the time, they're like, what do I need to do? I'm like, get on the inflammation webinar and then connect with me via phone. If you are with, outside the Chicagoland area, but still within the contiguous 48 states, you can go to the top of the page and you can register for that. When you click on that, and you'll see the inflammation webinar, it'll send you there and you'll be able to watch it right now, or you'll be able to schedule a time that you can watch it. And if you watch it right now, make sure you have an hour of your time, because as you get towards the end of it, you'll be able to see a link on there that you can schedule your discovery call with me at that point. So make sure that you do that. Statins and fatigue, guys, I went over the research, and I also went over to my experience with that. Let me know, has that been your experience? Let me know what your experience has been with that. And hopefully, people can start to wake up and say, wow, I didn't realize that this many people were having this experience as well. So I wanted to share that with you as well. And I also wanted you to know that, hey, my life, that's my training grounds as well. So one of the things from going through this that I probably have experienced is I always develop a whole new level of compassion for people. And compassion isn't feeling sorry for people. Compassion is an urgent rush to help. It's actually what it means. But I get to understand, I know what you're going through. And I feel so bad that you're going through this. I've been through a lot in my life, but all of this has had a purpose. All of this has led me to this point of working on being the best doctor that I can be for you, so that you can have your best health and your best life moving forward. So guys, statins and fatigue, make sure that you like this video, and please make sure that you share this video as well. Stay tuned for more content. I'll probably be going live next Monday as well. Give me a topic if you have one. Guys, I hope you found tremendous benefit from doing this. Be well, be blessed, and as always, remember who you are. Thank you guys so much again for watching. All right, guys, thank you.